Ehi compare, ci può suonare, chi si suona.
So, welcome to our episode on breathing. And today's episode is not just on breathing, but on breathing therapeutically. It's about breathing in a way that calms our bodies, improves the communication between our brain and our body, between our mind and our body, gets us more in touch with the state of our body, enhances our physical health, and helps us behave better. So there's a couple of problems with breathing, and the first is that interfere with therapeutic breathing. Okay, the first is that we're not very intentional about our breath. We don't think about how we breathe. We just breathe. And it seems to work out. Therapeutic breathing is different. It really requires a focus on a number of things that I'll tell you about in a little bit. The second problem with therapeutic breathing is that we don't teach people how to do it. And when people are upset, we just tell them to go breathe. But they really don't know how to do that therapeutically unless we train them to do so. And therapeutic breathing is like any other skill or muscle. You have to practice it. So you need to develop a practice in which we do this therapeutic breathing on a regular basis so that when we need it, it's something that will help us. Okay, so today we're going to learn how to do therapeutic breathing. And there are really 5 components to therapeutic breathing. The first is to breathe slowly. And we want to get, people breathe on average between 12 and 20 breaths per minute. We want to get that down to about 6 breaths per minute. The second thing we want to do is we want to extend our exhale. We want to have a shorter inhale and a longer exhale. Because when you exhale, it turns on that vagal brake I'm always talking about, and it slows your heart. And we'll talk more about each one of these things. I just want to give you an idea of some of the important components. The third thing is to breathe in your nose and out your mouth. And that has specific effects on learning, memory, your limbic system, your hippocampus, and your frontal lobes. And you don't get those benefits if you breathe in your mouth and out your mouth. The fourth thing is belly breathing, deep diaphragmatic breathing. You want to get your breath all the way down to the bottom of your lungs. You want to push your diaphragm down, which will suck all that air in. And that not only increases your oxygen transfer, but it does very specific things in terms of heart rate variability that empower this vagal brake. And the last thing that we want to do is practice this. We want to repeat this cycle of 6 breaths per minute. Inhale through the nose, exhale through the mouth, longer exhale than inhale, deep breath. We want to repeat that cycle for at least 5 to 10 minutes, at least a couple times a day. And that will give us the maximum sort of long-term benefits. All right. There are really 4 ways to use deep breathing or therapeutic breathing. The first is in anticipation of some upcoming stressful event. So if you know you have a meeting at work or something that's going to be challenging, breathe before you go in. If you find yourself in an interaction with somebody and you can feel your arousal start to go up, you start to get upset, maybe you start talking loudly, another good time to stop, take a few therapeutic breaths, calm your body down. It'll help you re-engage in a reasonable way. And the last part is that even if you've had an episode of some sort, it takes your body some time to recover from that. If you do your deep breathing after you've been upset, it'll settle down, bring your cortisol down, your stress hormones, and it'll settle your body down and help you to be calm. So, and the last part is that we need to develop a practice because long-term use of this has all kinds of benefits, including improving our heart rate variability, which I'll talk a little bit more about, but that's a measure of that vagal brake. And poor heart rate variability is a predictor of all kinds of bad health outcomes, including death. So you want to improve your health? Breathe therapeutically. All right. So let me tell you, give you some examples of how we've used it. And I'm going to tell you a couple stories first because I think they're really interesting and they make some good points. The first one is about this young lady we took to see a functional medicine doctor. And we've had really good luck with functional medicine in terms of improving people's health, which has really helped with their behavior. Anyway, we take this young lady to see this physician who's into functional medicine, and we're having an interview and we're talking, and all of a sudden her behavior starts to decline fairly dramatically. She starts getting upset, her voice gets loud, the amount of swearing goes up, all kinds of sort of quote-unquote bad behavior. And the physician takes the cue and says, okay, let's go in the other room and do a little physical exam. So she takes a break from the interview. And when she comes back from the other room, she'd hooked her up to a monitor, and our heart rate was 110. Now, for most of us, to get our heart rate up to 110, we need to do something like run really fast. And if you saw this kid at the table, this young lady at the table, you'd say the behavior's bad. You wouldn't realize it's the underlying physiology that's driving the behavior. And so what she needs is deep breathing. What she doesn't need is time out. Okay, so I thought that was a really good example of how critical dealing with the physiology is when you're dealing with people's behavior. The second example is really about how poor most of us are at teaching this. And so I went to a week-long seminar with Stephen Porges, who's the author of the polyvagal theory, which I use a lot of his material. Anyway, during the seminar he said, which was mostly therapists, week-long seminar, he wants us to take a break into small groups and do some breathing. And he wants us to first hyperventilate, quick inhale, shorter exhale, and see what that does to your body. And then he wants us to do this extended exhale, a therapeutic breathing, and see how our body feels. Well, so I'm in a group of therapists and everybody says, yeah, we teach this and we do this. And there actually is one expert in the group who teaches it regularly and really has some insight into therapeutic breathing. And she watches us all do it, and she says, when you did the hyperventilation, it was really no different than when you did the extended exhale. So these are the very people who are supposed to be teaching us this who are not particularly good at it. Anyway, let me give you a couple examples of how we've used it to help people modify their behavior, calm their bodies, and feel better. The first one is this young lady who comes to me, also in therapy, and she says she's having some difficulties with her roommates. And often when she gets home from work, there's a fight, there's, frustration and all kinds of emotions, and people not getting along very well. And, basically she comes to complain about her roommates. And, we talk about it a bit, and I'm not sure there's much to do about the roommates, but there probably is something that she could do so that she can engage better when she gets in and be more reasonable herself. And so we decided the thing to do is when she pulls into the driveway, take that first 5 minutes, just sit in the car and do her therapeutic breathing. So she does that, and she makes it part of her regular practice, and we sort of worked through it and taught her how to do it. And a couple of weeks later, I say, how's things with your roommates? She says, fine. I'm sure part of it was to do with the roommates, but part of it was she was in this sort of state where she was activated from being at work all day, and she really wasn't calm enough to sort of engage and be reasonable with her roommates. When she got herself in that state by therapeutic breathing, much more available, and the problems go away. The last example I want to give you is about a young fellow with autism. And one of the techniques to extend your exhale is to use exhale words. So we say, the ones we use are hu, ho, ha, hey. And so if you breathe in, breathe down deep and say hu, ho, ha, hey, it extends your exhale. All right, you don't need a breath pacer. The words pace your breath. And he was having some difficulty remembering the hu, ho, ha, hey. But fortunately, he's a fan of Santa Claus. So we switched it to ho, 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 ho. And he could remember that. And so I thought that was a good lesson for me in let's be flexible and enjoy this. And we want to give people techniques that they feel comfortable with. And so nothing's written in stone. Modify it, use it, combine the things, and get to a comfortable technique that people will practice. All right, so let me now go through each one of those things I talked about and give you some examples of how to improve or use those things. The first, you remember before I said we're not very intentional about our breath. We don't really monitor it. And when I'm in that group with people, I certainly didn't see the difference between the different types of breathing. This is a spirometer, all right? You can buy this at the local pharmacy, or they'll order it for you for about $4. And I haven't found it to be the most useful thing in terms of teaching breathing, but it certainly helps people be more aware of when they're inhaling and when they're exhaling. And so it's pretty simple. If you blow out, you can see the ball stays up. And if you breathe in, the ball comes back down. So what we teach people to do is just to play with it. Get more aware of what they're doing. And so, in the nose, all the way down to the diaphragm, and then and it's a good diagnostic tool as well, because what you find is that you think people are extending their exhale, and they're actually so that's number one. All right. So the first thing we talked about was that we need to slow our breath down to about 6 breaths per minute. Research on breathing began probably 50 years or so ago, or Western research on breathing. It's been done for a long time in the East. And what they did was brought in experts on breathing to learn about breathing. So they imported yogis from the East. And part of their regular practice is pranayama, or controlled breathing. And they asked the yogis to get into a calm state. And when they asked them to do that, they all did the same thing. They got their breath rate down to about 4.5 to 7 breaths per minute. And when they did that, what they found is that they decreased their heart rate, decreased their blood pressure, obviously decreased their respiration rate. They changed the electrical activity in their brain to a more calming state. And their electrodermal activity, or the skin conductance, that really is a measure of sympathetic activity. It's a measure of that fight-flight response. All of that calmed down. So a lower limbic response, a more reasonable person after deep breathing. In order to do that, most of us need a breath pacer, at least to learn how to do it. And there's a couple of different breath pacers we use, and you'll see them up on the screen here. The first one is from the Gibson Research Center, and it's called Anti-Stress Maximum Relaxation Breath Pacer. And the other one is Breathe to Relax. Breathe to Relax. Both of those are free. They can go on your computer and on your phone. The nice thing about both of them is that you can adjust the breaths per minute, so you can get to that 6 breaths per minute. And you can also adjust the length of exhale, length of inhale. So my favorite is the Gibson, because you can actually watch the ball go up and down, set it where you want it, and it's very easy to follow. And we put it right up on a television screen, and everybody in the room does it together. So really useful. The second thing is that extended exhale. And in order to understand the benefit of extended exhale, you really have to think about something called respiratory sinus arrhythmia. Complicated term, but it's actually pretty simple. If you go to your physician and you ask for your heart rate, he'll say, if you're healthy, it's about 70 beats per minute. Well, it's not 70 beats per minute. That's the average heart rate. Okay, so when you breathe in, your heart rate goes up, and when you breathe out, your heart rate goes down. All right. And that's really quite useful for a number of reasons. First of all, when you breathe in, you're bringing oxygen into your lungs. You want to capture as much of that oxygen so So your heart rate increases, so the blood flow increases, so you can get that oxygen. When you breathe out, it's really a good time to give your heart a break. And so when you breathe out, your vagal brake goes on, B-R-A-K-E, vagal brake goes on, and your heart takes a break, B-R-E-A-K. And over the course of your lifetime, you save about 350 million heartbeats by that little exercise. So it really extends your life. So there's a couple of ways couple tricks or tips about how to extend your exhale. You saw the spirometer. The exhale words are really useful. There's a couple of other things you could do. One is tap into procedural memory. So there's certain things you know how to do already that if you do those, it'll automatically extend your exhale. So let me give you a couple examples of that. This is chicken soup. And we've actually done this with chicken soup, by the way. So when you blow on your hot chicken soup, you blow like this. Softly and slowly. And when you do, because you don't want to blow the soup off the spoon, and you want to get the maximum amount of air across that soup so that it will cool. Well, that's part of your procedural memory. Most everybody knows how to cool down their soup. So if you say, okay, you got a group and you want to teach exhale, just and there's lots of different things like that, so you can be as creative as you like. You know, if you're dealing with kids, this is sort of one of my favorites. Every kid knows how to blow in chocolate milk, hence the cap on top. And you put a line here, you see, and you put your straw in and you blow in your chocolate milk, and you try to get the kids not to go over that line, just to go up to the line. And so, again, you take that breath in and you can see your exhale, and it's fun. It's a good exercise for kids. For adults, the chocolate milk is probably not necessary. Some adults, sure, makes it more fun. Just a straw. I did this with a very large group of people, probably 150 people in a room, and these straws are essentially free. Passed them out to the whole group. Because you're driving your exhale through that tiny little space there, it extends your exhale. Again, another fun activity for kids. You want to keep that thing moving. It only moves when you exhale on it. So again, breathe in all the way down, and so those are a few tips on how to teach it. You see how complicated it is because we're going to teach each step. The third thing is to inhale through your nose and bring it all the way down, okay? And again, the maximum benefit is going to be if you inhale through your nose and exhale through your mouth. You're going to get benefits in terms of learning, memory, calming down your limbic system, the seat of your fear response in your brain, and turn on your frontal lobes. So you're capable of being more reasonable, and you're going to be less reactive. You don't get those benefits if you breathe in your mouth and out your mouth. This is a little bit challenging to do. So what we teach people to do is to follow this path from the tip of their nose all the way down to the diaphragm, all the way down to their belly. So in the beginning, just breathe through your nose and get that sense of air coming through your nostrils. Just feel it right through there. And then go up to the bridge of your nose and feel it come in the beginning of your nose, or the end of your nose, your nostrils, and then up to the bridge of your nose. And then maybe to the top of your throat. So we're teaching people to track this breath from here all the way down. Top of your chest, so nose, bridge of the nose, upper throat, upper part of your chest. and then lower part of your chest, and then your belly. Pretty simple, but you see, you've got to practice it, and that's a really nice way to teach people how to do it. Just get your breath all the way down to the bottom of your belly, and that does a couple things. It maximizes the area in your lungs in which you're able to transfer oxygen, so that improves. But it also does something when your diaphragm goes down. What it does is impact your baroreceptors, and your baroreceptors adjust your blood pressure. So when you do that, you get the maximum resonance. And the maximum resonance means that you get those peaks and valleys, peaks and troughs in your respiratory sinus arrhythmia. When you get those baroreceptors involved, you get higher peaks and lower troughs. And that improves your heart rate variability. And so it's very good for your health. One way to teach that, and again, you teach it when you do the breath tracking, but if you think of breathing through your feet, I'd like you just to try that. Because when you breathe through your feet, breathe right through your toes, you can feel your belly expand when you do that. And it's sort of automatic. And of course, the last part of this is to develop a practice that you do as often as possible. When you develop a practice, I like to think that there's really probably three pieces to it. You need to think of a time. You need to think of a place, and potentially need to think of a person or people that you can do it with. If you don't set the time aside, most of us are so busy that it won't happen, right? And you have those ideas of doing it in anticipation of events that could be stressful, during stressful events, and after stressful events. But this is really a practice where you set aside some time to get good at this, all right? My favorite, really, and I think one of the easiest ways to use it, is before you get out of bed in the morning. So you wake up, do your therapeutic breathing, add 6 breaths per minute. All you're talking about is 30 breaths to get your 5 minutes. So once you get good at it, just lay in bed that first 5 minutes, do your deep breathing, and when you get at bed, it'll improve your day, right? And we'll look at the research in a couple of minutes, but what you also find is that it can improve your sleep. So 5 minutes in the morning or 10 minutes, even better. But when you get into bed at night, the first 5 or 10 minutes, do it again. It will improve your sleep. A 20-minute practice is sufficient for long-term health care benefits. And those other things, and then it can be used to improve your behavior at any point and help you with recovery and being calm. So be creative, enjoy it, and breathe therapeutically so you can be the kind of person you want to be. Okay, so now I'd like to cover just some of my favorite research on breathing. There's tons of research on it. There are some problems with the research because it's not very well funded. But anyway, we'll get to some of that. The other thing I wanted to say is when you think about breathing, one of the best ways to use it, particularly if you work in a school or with groups of people who regularly sustain stress, which is probably all of us, you institutionalize the practice of breathing. So if you're going to have an hour meeting, or if you're going to have a meeting with a kid who's had some challenges, or with a family, spend the first 5 minutes breathing. And what you'll find is, of course, the meetings will go a whole lot better because people will be more reasonable and calmer and grounded and able to hear each other and listen and really get to where they want to go. So anyway, that's one of the sort of rules for all of these techniques. Let's build them into our lives so that we use them regularly. All right, so let me tackle some of the research. And again, there's some problems with the research because it's not well funded. The drug companies are really not interested in breathing. It's kind of the skills instead of pills. And when we get to a little conversation about Inderol, which is a cardiac drug that performs something like breathing, you'll see that that typically in our society we give people a pill instead of teaching them a skill. And I hope from the intro part you realize teaching people to breathe is a little complicated. So the first research I want to go over is research by a fellow named Richard Gevirtz. And he researches and developed a technique called heart rate variability biofeedback. And what he does is, using biofeedback, he finds your exact resonance frequency. So remember I said breaths per minute was somewhere around between 4.5 and 7. And Gevirtz says the average person is about 6. But, it ranges from 5 to 7. So he can determine your exact resonance frequency, that you'll get the highest peaks and troughs in that respiratory sinus arrhythmia. And so he did a review article on heart rate variability biofeedback, and what he found was great effects in terms of physical health, mental health, and performance as well. So if you look at, and of course I'm most interested in the mental health effects, although the other effects are equally great. So if you look at the research on depression, depression is positively affected by therapeutic breathing or heart rate variability biofeedback. Anxiety, social phobia, positive results using breathing. Post-traumatic stress disorder. And this is one of the most challenging disorders we have to deal with, and lots of people have it, including all the returning troops from all of these wars we've just fought, and from all the wars we probably will fight in the future. There's a tremendous amount of suffering, and there aren't very good treatments for it. Breathing is a good treatment. So we got positive results with that. And performance. So Gevirtz has an ex-student his whole career, his whole practice is about helping baseball players increase their hitting percentage by increasing their heart rate variability using heart rate variability biofeedback breathing, therapeutic breathing. So let's go into a couple of the studies on post-traumatic stress disorder. And a recent study came out on heart rate variability and post-traumatic stress disorder. And it turns out that if you have poor heart rate variability, right, you don't have those big peaks and troughs, you have poor heart rate variability, and you suffer from a traumatic event, you're much more likely to get post-traumatic stress disorder. So everybody who goes through some trauma does not get a mental health disorder out of it, but many people do. And if you have poor heart rate variability, you're more likely to get develop post-traumatic stress disorder. So I want to talk about sort of 3 studies in there. The first one is on PTSD and resurgence. So what people do is they get your sympathetic system up, and they do it by exercise. So you want to get your heart rate up, go running. Well, when your heart rate is up, how does it come back down? Well, when you apply that vagal brake. And so what you find in the PTSD studies is that heart rate variability goes up. If you do your therapeutic breathing post-exercise, post some traumatic event, post a challenge, post being upset, and it decreases your PTSD symptoms. So your depressive symptoms and anxiety, hyper-arousal, all of those things go down. There's one study I want to highlight out of those PTSD studies, and I actually extracted some of the data for you. Again, you get a significant decrease in depression, a significant decrease in post-traumatic stress disorder. But they looked at it, well, you also get a 90% completion rate. That's extremely high. So it means 9 out of 10 people who went into the study actually completed the treatment. That's rare for post-traumatic stress disorder people. They don't benefit very much, and they quit therapy or treatment rather quickly. So if you look at the data that I've extracted here, what you see is that time 1 is before treatment, time 2 is post-treatment, and you see significant changes in hyperarousal, that's sympathetic, fight-flight response. You see a significant decline in post-traumatic stress disorder, and you see a significant decline in re-experiencing the trauma. So the trauma is something that haunts us. and it's very difficult to get away from it. And this is one way. Now, if you look at time 3, what you see is that they did a month of treatment, and then time 3 they came back a month after treatment was completed, and they found that the results held. And then they came back time 4, it's a year later. And you see that not only did some of the results hold, or all of the results hold, but in some cases they even improved. So it's a long-term benefit, this therapeutic breathing. Another sort of area to think about is cortisol. So cortisol is your stress response. It's your stress hormone. When you get stressed, you secrete cortisol. Cortisol puts fuel into your bloodstream so that you can get jacked up and your muscles are able to do all the kinds of things like run away and fight. If you do deep breathing, you actually get a decline in your cortisol. So it's a direct measure of your stress response. So in one study, they found not only did your, and this is again post-exercise, so you got your sympathetic system going, and then you did your deep breathing, you found your cortisol level dropped significantly from the deep breathing. Also, your melatonin went up. And that's sort of interesting. And it also sort of makes me think about the sleep results from that meta-analysis by Gewirtz before. So melatonin, many of us take that for sleep. Now melatonin is just, it doesn't put you to sleep. It tells your body it's time to go to sleep. So it's brought on by the darkness. So it makes sense that it would actually help improve your sleep. And then there's a few more studies. And what you find is the same thing. Decreases in cortisol with therapeutic breathing. In this last study here, you'll see also an increase in attention, in your capacity to pay attention, and a decrease in negative affect, negative feelings. So now you combine those three things. It means your stress response went down, your frontal lobes came up, started to power up, you're more reasonable, you can pay attention, and your limbic system calmed down. All really lay the groundwork for reasonable behavior. And the last group of studies I wanted to talk about are really interesting because they center on Inderol. And Inderol, or Propranolol, is a cardiac drug that's used quite a bit in mental health. And what it does is puts a cap on your heart rate. It's a beta blocker. So your heart can only race so fast. And it's used for social anxiety and other things. Public speaking. It's called, some people refer to it as the public speaking drug. And lots of people who have to get in front of a crowd who don't do that regularly take Inderol or Propranolol. Actually, they did a survey on people's fears, and the number one fear was public speaking. Number 2 was death. So I'm not sure what that says. Anyway, more recently, they've used it for post-traumatic stress disorder. So if you have experienced a traumatic event and go to the emergency room and you get Inderol in the emergency room, that decreases the likelihood that you'll get post-traumatic stress disorder. In other words, it keeps your heart or your body from running away on you, and then it keeps, then the memory that you put in is of a calm body and an event, instead of the memory of the event and a very excited body or very upset body. And they followed it up with a number of studies where they used it as treatment for post-traumatic stress disorder and got a very good result. And so what they did was they had script-driven traumatic events. So you had a car accident, you come in and you script out what happened. And then over 4 sessions, they give you Inderol and you reread the script. And you're reconstituting that memory, but at a lower arousal level because you're on the Inderol. And what they find is, of course, that the PTSD symptoms improve. So now the reason I tell you all of that is because there's a study of Inderol versus therapeutic breathing. And so therapeutic breathing performs as well as Inderol. In fact, it performs slightly better than Inderol. But over the course of a year, when they follow those patients, deep breathing actually works substantially better than Inderol. So the long-term benefits of deep breathing are as good as Inderol, and again promotes this idea of skills, not pills. So breathe on.